Better at Home Mederi Caretenders recently spoke at the Heart to Heart Symposium for medical professionals at Mission Inn. Shaunda Luken explains their continued involvement and the benefits of this symposium.
So today's event is the Heart to Heart Symposium. We are a premier sponsor every year. We firmly believe in supporting and educating the community on congestive heart failure and the little education we can bring to the table for case managers, discharge planners, and nurses on the floor, the better it is when they're discharging their patients. They're really not aware of all the things that we can do in the home to prevent unnecessary ER visits and hospitalizations. So this is a really valuable event for us to attend and kind of get the word out to the physicians that are attending as well as the case managers. When you get to be a certain age and they've got comorbidities already, so they may have congestive heart failure, diabetes, they may also be battling cancer. Anytime you can prevent going to the hospital, it's just better for them, and patients tend to heal faster and to do better in their home setting than they would in a hospital setting. We have a new program that looks at patients that maybe have had a hospitalization in the past few months or a recent discharge from the hospital, if their comorbidities are. We will actually see those patients more frequently on the front end to prevent them from going back to the hospital. And we've been able to reduce our readmission rate overall by doing that. But the benefits we mentioned today was the high-risk hospitalization as well as how we approach a congestive heart failure patient. So for example, we have a patient that was discharged from the hospital. We can see them same day as that discharge and then daily for 3 to 5 days. Most readmissions to the hospital from a congestive heart failure patient will happen within the first 72 hours of getting home. So by doing that, we've eliminated that risk of going back to the hospital, and then we start the education process. We'll educate them on their diet and nutrition, what to look out for with an exacerbation, what's a red flag for entering a red zone for congestive heart failure, and how to offset that. We also have the ability to do IV Lasix and IV Bumex in the home, which diureses the patient of all the extra fluid. We also make sure that the patient has the same nurse from start to end, so we have that continuity of care so that if the patient's been discharged, that nurse knows what's normal. So if we start to hear that the patient's starting to get wet, like that fluid's building up again, then we can go ahead and preempt that by giving a call to the physician, either doubling up on their PO Lasix, which is by mouth, or starting the IV lines in the home to go ahead and diurese them to prevent that unnecessary ER visit. So those were some of the tips and things that we talked about today.
For more information on the services offered by Better at Home and Mederi Caretenders, click on the Heart Symposium story icon link on our homepage, yourhometownhealth.com.